Good morning. Good morning. So, I've been a little bit absent. I'm 7 weeks and 4 days. Yeah, 7 weeks, 4 days post-op. As promised, I know it's taken a while, but I needed to get myself in the right headspace. I'm going to do some frequently asked questions. So today, frequently asked questions, I'm going to focus on what happens before your operation. Okay, so in this order, so you can fast forward if you don't want to listen to my dulcet tones, I'm going to talk about pre-op exercises and getting ready for op. Then I'm going to talk about what to expect at your actual pre-op with the hospital, and then what to expect at your admission and as you're going in for your operation. And some of the things that happened to me that I've learned from, that I think you will all benefit from and knowing about and being prepared for. So, number one, pre-op exercises. So just to let you know that I was an athlete and then I couldn't run. So my BMI was really good. It ended up being 29. So that is over the recommended. I don't know if that's classed as obese or not. If you were to look at me, you wouldn't say I was obese. People say that I've actually got quite a nice figure, although I don't think I have myself. Anyway, what I did was I did a lot of walking. So I tried to do as much walking as possible. So I'd got that level of fitness. When the walking wasn't possible, I went swimming. And swimming is so good for you. So you can actually buy floats that are really cheap if you can't do the breaststroke kick or you're not fit enough to do front crawl. You can actually get a float, hold the flow and kick. And you can go backstroke and you can go front crawl. And it isn't crazy energetic. It gives you fitness and it also strengthens your legs. Now, what I would suggest is when you go and speak to your surgeon or when you get a date for your operation, ask them for some pre-op exercises, okay? And they will give you exercises that you can actually do in the home without having to have weights or go to the gym or anything. What you need to be doing is making your quads, so they're the big muscles down the front of your legs, as strong as possible, both legs. Also, you need to try and get your hamstrings strong and your glutes. So a lot of the exercises they ask you to do after the op are also what you should be doing before the op. Okay, and also do some stretches. Try and stretch out as much as you can. Try and get your leg as straight as possible in the bed. Ask for those exercises and start doing them and build them up. You will find they will help you tremendously when you have had your operation. Okay, so they're pre-op exercises. If anybody would like more information on what I did, and what you can do that doesn't involve going to the gym or to a swimming pool, give me a message and I will message you back. Or I'll do another one just on pre-op exercises. So your pre-op, this is having that appointment with the hospital. Now, this will not be on the phone. This needs to be in person, and they do your height and your weight and your BMI. They do all your bloods just to make sure you haven't got an infection or anything to worry about. They go through a number of questions about medication, and also they should be asking you, what do you know about what is going to be happening to you? Now, I didn't get asked that question. What I got thrown at me was a load of leaflets. So that really didn't help because you're there trying your hardest to listen to them. It's all quite scary. And, if you're anything like me, I was a bit anxious. So take a list, write a list of everything that you're worried about and anything that you need to ask, because this is the place to do it. Okay. They will tell you a lot, but a lot of what they tell you doesn't really answer a lot of your questions. So before you go to your pre-op, do a list and ask as many things as you want and don't feel rushed. This is your time. So, one of the things I would have benefited from is knowing about any joint clinics or physio sessions or support groups in the area. At the end of the day, you are not the only person that is going to be having a knee operation in that hospital on that day, or in that week, or in that month. So there are going to be quite a few people going through this at the same time as you, and it would be good if you could link up with them. Because I know for a fact that if I had somebody going through this at the same time as me, that I could speak to, reach out to, even if it's just a text or WhatsApp or Facebook or whatever, and they could say, oh my God, this has happened. I can think, yeah, that happened to me. Right, okay, so that's normal, and it's good to see and help each other through this. So also what you need to be asking, and I didn't know this, that the hospital I went to has some kind of block on the whole building. So nobody's phone worked. So you couldn't get any signal at all. Whatever provider you were with, your phone would not work. And that is for emails, WhatsApp, or phoning people. So of course I come out of surgery and I want to let people know I'm okay, and I can't. And nobody had given me a number to give to my family so they could ring to see how I was getting on. It's the simple things. So you need to understand if that is a problem for you, where you're going to be having your operation, and find a way around it. Now, the hospital I stayed in gave you free internet, but unless you have family that use WhatsApp, then the only way you have of contacting them is using social media or emails. And I couldn't do that because my mum was my next of kin and she's elderly and she only has a phone. So I couldn't get hold of her. And my son was working. So it's something to think about. So that is your pre-op with the hospital. So on admission, so a lot of people say to me, what should I pack? So I'm going to show you something here. This is what they gave me when I got on the ward. So they put you in your bottom revealing gown, but you're allowed to put your paper knickers on. And they give you these socks. Okay. So these have got rubber on the bottom. And they actually say in the list, in the pre-op document that they give you, they actually say to bring slippers. Now, the thing is, a lot of people struggle to actually get the slippers on. And then once they've got them on, they can't get them off. So if you need to get out of bed, go to the loo, anything like that, you're completely reliant on a nurse or somebody in the ward come in, putting your slippers on, taking your slippers off, etc. If you get a pair of these, and you can get them from shops, I have a pair that is just a little ankle pair, and they've got rubber on the bottom, and they stop you from slipping. And you can put them on and keep them on in bed. Keep your feet nice and warm as well. And that way you can walk around and you're not going to slip, and you don't need to be twisting your leg thinking about putting slippers or shoes on. So what else do you need to know? Make sure that you have your charger for your phone. I actually took a water bottle. So I wasn't reliant on the nurses and ward people coming and filling the little cups, because you might be thirsty and you might be waiting a while. So I took a big water bottle that holds 2 litres of water, and I put a bit of cordial in it, and they just would fill that up for me with a jug. And that way I could see how much I was drinking as well. So they're very keen on monitoring how much you drink, by the way, because if you have too much water, you lose a lot of sodium. And if you lose a lot of sodium, you then can't be discharged. I'd also suggest taking wet wipes, because again, some of the hospitals can be quite warm. You might feel a bit sweaty and sticky. And instead of being reliant on nurses and people to come and wipe you down or take you to the bathroom, if you've got some nice wet wipes, it's nice to just wipe on your face, under your arms, that kind of thing. And if you don't feel able to go to the bathroom at night, to have a wash, if you've got your wet wipes, then, it makes you feel a lot better. Some hand cream, that's always nice to have, so that, your hands get quite dry. Your toothbrush, don't forget your toothbrush and toothpaste. And glasses, if you have readers or contact lenses, you have to take your contact lenses out. So don't forget your distance glasses if you need them. A book or puzzles or something, because you will be awake. Very, very few people sleep on the first night. It's a very uncomfortable night. So rather than lying there in the dark or with a silly little light on, wondering what on earth you can do with your life, get something that can entertain you. I had Sudoku and puzzle books and a reading book. The TV was pointless, because you're just going to wake everybody else up. And it didn't have any signal anyway. Now, the other thing that I would tell you about that you need to prepare for is when you actually leave the hospital, and you need to make sure that the vehicle that you are picked up in is long enough to get you in the front seat, okay? Because you're going to really struggle to bend that leg, and you need to be able to maneuver yourself into the front of the car. So if it's a little car that that you're going to struggle to get into, really have a think about who picks you up, and also ensure that you talk to the staff on the ward and they help you getting into that car, and maybe give you some support on how you might get out at the other end. I was left to my own devices and it was horrendous. So you need to think about that seriously. Finally, pre-op, a lot of people have asked me the question about the epidural spinal block. The reason they do this is because it is quicker for you to recover. So you don't have that general anaesthetic that takes ages for you to come out of anaesthesia. So you do not feel anything, you do not hear anything, you should not be aware of anything, okay? I asked to be sedated, and generally they do sedate you. So that is a question you need to ask in your pre-op and on your admission. Make sure if you are nervous or anxious that you insist that you have sedation. I was so sedated, I don't remember a thing. The injection going in your back, I had to have 3, and I only had to have 3 because I have disc dehydration disease. So I have, my lower lumbar is almost fused. So I explained that to them. So if they don't know if you've got a spinal stenosis or you have anything similar to your lower back being fused or dehydrated or degenerated, let your anaesthetist No. Very important. But once the injection had gone in, I started going numb, and yeah, it's a weird feeling, but it's fine. It doesn't hurt. Seriously, it doesn't hurt. Do not be worried. It's fine, honestly. The other big thing I would just make sure that you check is the pain relief they intend to give you. So you need to ask about this at your pre-op at the hospital, but you must double check this when you are actually going in for your operation and you see your anaesthetist. Make sure you are 100% clear on what they intend to give you to manage your pain when you come out of surgery. They got my allergies wrong. They got it completely the wrong way round. So I literally ended up with no pain relief. Normally, the go-to is morphine sulfate. They had me down that I was allergic to all of that. So what I got was, it was horrendous. So make sure you know exactly what you are going to be given and that your pain is managed. That is the most important thing. Because if your pain is not managed, it will be unbearable. Okay, so that is a massive thing that you need to speak to them about. It's your body and it's your quality of life and it's your experience. So make sure you know what the plan is for your pain and what to expect. So that's it. We're 16 minutes. Hopefully you can speed through all the bits and pieces if you don't want to listen to all of it. If you need me to focus on any one area, let me know in the comments. But tomorrow I will talk about when you come out of surgery. There we go. Okay, have a good Thursday. Love you all.